My name is Dr. Maddison Campbell. I'm a clinical psychologist and trained in neuropsychology in Australia before moving to Edinburgh. Neuropsychology is a type of psychology that's interested in the relationship between the brain and behaviour. So neuropsychology is important in the diagnosis and treatment of neurological conditions or suspected neurological conditions, so things that impact or have an effect on the brain and how the brain functions. So someone might see a neuropsychologist after a brain injury or a neurological condition to try and understand what the impacts of that condition are on their thinking, behaviour and their emotions. Often people will come to a neuropsychology service after a brain injury or acquired brain injury, like a stroke or traumatic brain injury. You might also see a neuropsychologist for something called cognitive rehabilitation, and that would be developing strategies to manage difficulties in thinking, so things that can help improve memory and adapt to cognitive changes. At the Edinburgh Practice, as part of the memory clinic, you might see a neuropsychologist and complete a neuropsychology assessment. These assessments can be quite lengthy. So they take between 2 and 4 hours, but we try to break these up so that it doesn't feel like you have to do it all at once. The neuropsychologist will meet with you to ask a lot about things that can affect your thinking, so things like your medical history. We'll ask you what's happening at the moment, how things might have changed, and we'll understand what your goals are for assessment and coming to the memory clinic. Once we complete the assessment portion, we'll then put together a report that includes all of the information that you've given us, that we've gotten from testing, from our observations, and often from getting information from people who know you well. We'll then use that report to talk you through what that might mean for you, if there's any information regarding diagnosis or any treatment that we can recommend, and then we can offer or recommend ongoing support for things like coming to terms with a diagnosis or managing areas of difficulty that we might have identified. So things like how to develop memory strategies or use routine or structure to help your thinking and to help you do the things that you want to be doing. At the Edinburgh Practice, you don't need a referral to be seen by one of our neuropsychologists. Often, if you're seen as part of our memory clinic, you'll also work with our psychiatrist, and at the Edinburgh Practice, working alongside each other means that we can communicate really easily, and that helps the assessment process. An assessment with a neuropsychologist can be stressful for some people, and it can be lengthy, so at the Edinburgh Practice we are as flexible as we can be in organising these appointments and doing it in a way that's as relaxed as possible and hopefully the most useful for you.